Hi everyone, in this video from Count Backwards from 10, we're going to take a look at part 1 of 2 at our depolarizing neuromuscular blocking agent, succinylcholine, or SCH for short. This is our only depolarizing neuromuscular blocking agent used in humans and in clinical practice. As always, we're going to go ahead and take a look at our general outline for all of our pharmacology videos. This one being a little different because miscellaneous takes up a pretty good amount of this, which is what we're going to look at in part 2. So, let's get started. So the drug type in this case is a depolarizing NMB, or a neuromuscular blocking agent. Now dosing comes IV and IM, with IV being anywhere from 0.5 to 1.5 mg per kg, and IM being usually 3 to 4 mg per kg. Now, this will produce muscle relaxation at about 30 to 45 seconds. As for duration of action, we're talking anywhere from 5 to 8 minutes usually, at least with a normal phase 1 blockade, which is something we'll talk about a little bit later. Now, I do want to note here, and we'll talk about it a little bit later as far as helping prevent fasciculations, but we need to increase our dose by 50 to 70% if we use a subparalytic dose of a non-depolarizing muscle relaxant prior to the use of succinylcholine to help prevent fasciculations. And this is in order to ensure that you have complete paralysis. So you have to increase your dose if you're using a non-depolarizing muscle relaxant. So, mechanism of action, how does it work? Well, as it turns out, the succinylcholine molecule looks just like the acetylcholine molecule. It's really two acetylcholine molecules kind of jammed together. And what it does is it binds the ACH receptor the same way acetylcholine does at the 2 alpha subunits, and this results in membrane depolarization. Just like a normal acetylcholine molecule will. Now, this is why our patients will fasciculate or move after succinylcholine has been administered, because like acetylcholine, it's going to cause movement and depolarization at the motor end plate. This causes paralysis, though, because the resultant hyperpolarization of the motor end plate makes it so that normal acetylcholine molecules can no longer bind and activate those same depolarized acetylcholine receptors. Like I said, this is also known as a phase 1 block. Now, I am going to mention it here, but it's going to come up in part 2 when we discuss kind of our miscellaneous. There is something called a stage 2 block. This is when the repolarized acetylcholine receptor does not respond to a normal acetylcholine molecule attaching to it. The exact mechanism is unknown, but may involve some type of refractory or non-excitable parts of the motor end plate as a result of succinylcholine binding. This will demonstrate a continued flaccid paralysis that looks like a non-depolarizing muscle blockade, and it will last longer than 5 to 8 minutes for our phase 2 block. Now, this most commonly occurs when greater doses greater than 5, well, actually I'll put it over here, phase 2 block occurs at doses 5 milligrams per kilogram and above, or with repeated doses. So on to metabolism. As I mentioned, the drug only lasts about 5 to 8 minutes, and that's because of hydrolysis via plasma and pseudo cholinesterases. These are enzymes that break down the succinylcholine and acetylcholine molecules. Now, they are made in the liver, so patients with liver failure may have problems degrading succinylcholine, which can result in longer lasting effects. Now, a trick question that is going to come up is, how do the effects of succinylcholine stop? And you oftentimes have it presented that it is metabolized by these esterases, which, while it is true, is not the reason for the mechanism of the drug stopping. But these esterases are located in the blood, and actually very few exist near the actual motor end plate. Thus, succinylcholine must diffuse away from the neuromuscular junction into the blood in order to be broken down. So it actually stops working by disassociation away from the motor end plate rather than from metabolism. Now, I'm not going to talk about in this video, but there are patients with atypical plasmacholinesterases that also have a hard time breaking it down, and that will be its own video. So as always, let's take a quick look at our system by system, with cardiovascular being the first and probably the most prominent. In this case, you can experience sinus bradycardia, junctional rhythms, and even cardiac arrest. Now, while this is rare, it is still possible and can be pre-treated with a small dose of atropine a few minutes before administering the sucks. Now, why is kind of the question. Well, succinylcholine can work on the muscarinic receptors of the heart the same way acetylcholine will. And as we know, acetylcholine is the predominant neurotransmitter in the autonomic nervous system, specifically the rest and digest portion. This would result in slow heart rate, even all the way down to asystole and possible junctional rhythms as a result of the slowed conduction and heart rate. The respiratory effect should go without saying. Respiratory arrest, and this is secondary to the fact that, well, you're paralyzed. Your diaphragm is paralyzed. You can't contract it. You cannot take a breath. And as for the central nervous system, there is a rise in ICP, but this is clinically negligible. So really, a lot of the important parts of this video, obviously all of this stuff is important. It is going to be tested on, and it is important to know and understand. But the other half, which we're going to look at in part 2, is going to be all these other kinds of miscellaneous things, like this concept of phase 2 blockade that doesn't really fit into our cardiovascular, central nervous system, respiratory effects. And so in part 2 of this video, we're going to look at all of the other miscellaneous effects that come out as a result of the use of succinylcholine. That's all for part 1 of succinylcholine. As always, if you have any questions or concerns, please feel free to write in. Click the like button below, subscribe, follow us on Count Backwards from 10 on Instagram, and stay tuned for the next video.